Hey there, and welcome. If you're here, chances are you're caring for a loved one with a serious illness and you're looking for answers. Well, you've come to the right place. We've put together this simple guide to help you understand palliative care and feel a lot more confident about it. Okay, so let's just get real for a second. It is completely normal to feel overwhelmed, confused, maybe even a little scared when you're in this situation. You're dealing with so many new terms, new faces, new challenges. It's a lot. It really is. But here is the one thing I really want you to hold on to through all of this. You are your loved one's most important advocate. Nobody knows them like you do. And our goal here is to give you a simple, clear guide to help you be the best advocate you can be.
So first things first, we have to clear up the biggest point of confusion out there. What in the world is palliative care really? For a lot of people, that term sounds kind of scary. So let's clear the fog on that right now. Okay, look at this. This is probably the most important distinction to understand. Palliative care is not the same as end-of-life care. Not at all. End-of-life care, or hospice, is for someone in their final days or weeks. Palliative care is so much broader. It's for anyone who is living with a serious illness at any point.
So what's the big idea behind it? It really just boils down to one thing: improving quality of life. It's an entire approach that's focused on giving relief from symptoms, from pain, and from all the stress that comes with a serious illness. It's all about helping someone live as well as they possibly can. And this is a huge deal. Palliative support can start from the very moment of diagnosis. Think of it as an extra layer of support that comes in right alongside all the other treatments, like chemotherapy or physical therapy, that are meant to cure or control the disease. So now that we're clear on what palliative care is, let's talk about the most important person on that care team. And I'm going to give you a hint. It's you. Just take a look at this. You see all those different people? The doctor, the nurse, the therapist, they're all there to help. But who is right there smack dab in the center of it all? It's your loved one, and you. You are the heart of this team. Nothing happens without you. And I want you to let this sink in. Please, never, ever forget this. The medical team, they're the experts on medicine, for sure. But you are the expert on your loved one. You know their little quirks, what soothes them, what they truly need. That knowledge is priceless. It's something no medical chart can ever capture. I love this way of thinking about it. You are the bridge. You connect your loved one, who might be tired or unable to speak for themselves, to the entire medical team. You are their voice. You make sure their needs are understood. That is an incredibly powerful role. Okay, so it's one thing to know you're the expert and the bridge, right? But how do you actually do it? How do you speak up effectively? Well, this next part is your practical guide to making sure you're heard. We call this advocacy, but don't let that word intimidate you. Advocacy doesn't mean being pushy or making demands. It just means working with the care team, collaborating, being a partner to make sure your loved one gets the absolute best care. It's all about teamwork. So when you have a concern, how do you get them to listen? It's actually a pretty simple 3-step recipe. First, stick to the facts. Be specific about what you're seeing. Second, offer a possible solution or ask a question. And third, always follow up to see if it worked. And this example just hits the nail on the head. So instead of just saying, she hates her bath, which is kind of a dead end, try this. This question is factual. It offers a specific solution. It gives the nurse a concrete plan to work with. See the difference? It's a game changer. All right, so you've got the tools for speaking up. But what's the real secret to making sure people actually listen? Well, you might be surprised to hear it's not just about talking. Let's look at the other side of that coin. To be a truly great advocate, you have to be a great listener. And I don't just mean waiting for your turn to talk. I mean listening to empathize, really trying to understand where the nurse or the doctor is coming from. When you do that, you build trust, and that makes them want to partner with you. And now for what might be the simplest but most powerful tool in your entire toolkit. Advocacy is also saying thank you. Seriously, when a nurse or an aide feels seen and appreciated by you, it builds such a strong bond. It makes them your ally. A little bit of gratitude goes such a long way. Wow, we have covered a lot, so before we wrap this up, let's just boil it all down to the absolute must-remembers, the key things to take away from all this. If you remember nothing else, please remember these 3 things. Number 1, palliative care is all about improving quality of life, and it can start anytime. Number 2, you are the expert on your loved one. Own that. And number 3, when you speak up, use facts and offer solutions.
So, I'm going to leave you with a little challenge, a question to get you started. You have the knowledge now, you have the tools. All that's left is to take that next step. So, what is one question you're going to ask the care team this week to help make your loved one's life just a little bit better?